had a
Sorry.
it's okay, nice warm weekend, hopefully, with nothing nefarious happening to your homes, like frozen pipes. I'm Janna Simon here at Illinois Public Health Institute. Glad to see you all. I think many of you were here for the last meeting where I give a more robust update. I have a short update today, but as you know, this group has been working to advance access to the National Diabetes Prevention Program and diabetes self-education management and self-management education support services, or DSMES. And there's some federal grants that the state has and IPHI has to help advance those programs throughout the state. But one thing that's been long identified is there's not always full engagement from healthcare providers to screen folks in the first place for prediabetes. And so one of the ideas that came out of this work group a while ago was to help increase healthcare provider screening and enrollment or referral for these programs. And over the last several years, the American Medical Association has been developing uh, quality measures. And so this group started looking at a way of engaging in those quality measures here in the state to advance some accountability for providers to screen folks. So we know that Medicaid started covering the diabetes prevention and management services for Illinois in 2022. And then we know the U.S. Preventive Services Task Force recommends that the folks with those bullet points on the screen who are at risk for type 2 diabetes should be screened for both prediabetes or type 2. And then if they are in the prediabetes space, there's that they should be referred to prevention interventions. So while this is a task force, it's not necessarily common practice. And we even have heard from focus groups and things that people say, well, my doctor said I only had prediabetes, so they celebrated I wasn't yet diabetic and sent me home. Rather than understanding that prediabetes is something you can try to intervene with to prevent the onset of type 2. So if you go to the next slide. The American Medical Association has worked for several years now to develop quality measures, and they work to get them into um, with Federal Center for Medicaid and Medicare to get them into some of their quality measures there. And it's an electronic clinical quality measure, which means it's free to healthcare organizations. And they have three that you see on the screen. So one is for the screening of abnormal glucose, and then the other is for the referral to interventions. And so we, as you may recall, created a letter. We've also been working with the state Medicaid agency over the last several years to keep them up to date on what AMA has been up to and share these measures. And in the fall of last year, we circulated a letter to IAPOH, all of you. Many of you signed on, so thank you, in support of the state considering these quality measures in our state Medicaid system. So we had some great conversations with the state. They've let us know that the letter we sent was very insightful and has informed some of their internal discussions at the state. And we're just waiting on some final information to see what will happen. But very positive support and interaction with the state once that letter was sent. So just wanted to share that with you all, and hopefully we'll have some information coming soon from them on what they've decided to do. But just wanted to share that and say thank you to everyone who signed on. And just a reminder that sometimes letters getting to them at the right time during their internal discussions can be super helpful. So again, hopefully we'll have by the next meeting a more formal update from them. But for now, just wanted to share that this continues. The discussions are positive and we'll see where it goes. So thank you. Any questions about any of this? I know it might be new for some of you, but any questions around this? Okay, I will turn it. Rebecca, are you introducing the
I
next part?
am.
All right. Thank you
I'll
all.
I'll be I'll be here all day. Okay, great. Thank you so much, Jan. I appreciate that. We're now going to hear from Gayle Jennings from the SIU School of Medicine. Gayle's presentation ties to our work group goal to eliminate barriers to participation in diabetes prevention and management programs by ensuring participants' social needs are met. So please take it away, Gayle. Thank you so much.
You're on mute, Gail. Oh, now we can't hear you though. We still can't hear you.
How about this?
There you go. Yep.
Just changed it to a different setting. All right, well, hello. I get to talk through what we're doing here at SIU Family Medicine in Springfield for our diabetes food as medicine program. And so go ahead and I guess you have to advance the slides. All right. Yeah. So I'm Gayle Jennings. I am a registered dietitian and certified diabetes care and education specialist at SIU Family Medicine in Springfield. And next slide. The topics for our menu today are, I'm going to tell a little bit more about the Medicaid 1115 waiver and tell you about our clinics here in Springfield as well as Carbondale and what we're doing with this program. Discuss the application process and getting started and the screening process that we've done and will continue to do, and how we're trying to connect our patients with the produce, with the diabetes classes, the culinary classes, and then also those some small kitchen necessities. And I'll tell you more about that, where we are currently, and then also our plans for the future. Next slide. So the Medicaid 1115 waiver as a grant money through the Illinois Public Health Institute. And the award was for $19,500 total through the end of June of this year. Initially it was $14,500 through the end of December of last year, but then an extra 6 months and $5,000 was added in late November or December. And so we agreed upon that. And this is from just the direct application. The purpose is to convene a community of practice for community health centers addressing chronic disease risk reduction and food insecurity by screening our patients for health-related social needs, building or expanding on our food as medicine interventions, and increasing enrollment and retention in diabetes self-management and support services. And since Janna just talked a little bit about the diabetes prevention programs, that is also one of the avenues that can be used in this too. We just don't do that here. Next slide. So basically, we're trying to connect our patients who have diabetes that are screened to be food insecure. And then the other criteria are having Medicaid for insurance or a managed Medicaid program. And then connecting those individuals with a produce prescription program, the diabetes education, which can be in classes or individual. And then another addition that we added was culinary medicine classes. So how to use that produce. And I'll explain more in just a minute. So looking at just what we are here in Springfield, we're a federally qualified healthcare clinic. We have a residency program for family medicine physicians, and we have residents in Alton, Carbondale, Decatur, Quincy, and Springfield, and then other smaller clinics across the state too. The ones under supervision for Springfield are Jacksonville, Lincoln, and Taylorville, all within about a half an hour of Springfield. And so we're the largest one here in Springfield. Many offerings to our patients. We have about 60 physicians, MD physicians, DOs, nurse practitioners, physician assistants. So we have a large group of providers that send referrals. And then 30 of those are residents, and our residents are here for 3 years. So there's about 10 in each class. And no, I'm not done yet. So we have a lot of offerings to our patients, as you can see, and this is just kind of the touching the very tip of it. Midwise, we recently opened up a dental program, which has been a huge asset to our community. We, of course, have a great behavioral health team, community health workers, a geriatric and palliative care clinics, our nutrition and diabetes education, an unhoused mobile clinic. So someone uses a van and does some clinical care at the Salvation Army. We have a child advocacy clinic, comprehensive care, palliative care, survivor recovery, and many more. So there's just, and then the other dietitian and myself. So there's 2 dietitians here. And we also do the diabetes education, the medical nutrition therapy, and then the intensive behavior therapy for obesity, plus a whole lot of diabetes technology. So we have a lot of things, a lot of balls in the air to continuously juggle. And just another fact that the only other clinic out of those other 5 larger clinics across our FQHC, the only one that has a dietitian is Indicator. So next slide, please. So getting started, the application was interesting. I found out about the waiver through a colleague at IDPH, Kuchera Tracy. She's the diabetes program manager there. And so I went through the various multiple steps to apply, and it wasn't too overwhelming as far as what IPHI was concerned, but SIU required a lot. This is the first time I'd ever done such a grant such as this. So the first thing you got to do is build a team, right? A cool connection was I first reached out to our director of our community health workers and got her involved. Her name's Erin. But in the meantime, Dr. Stacy Satovia, who is a physician with internal medicine and then also runs the culinary medicine program, she had reached out to Erin as well with interest on this. And so with us having the diabetes education program here, it made sense that we would, house it here and include the culinary medicine program. So that was a very nice connection just right off the bat. That wasn't, in the initial application or anything, but just something that we wanted to do for our patients. So we're using some of the money to buy the produce or the food supplies for their culinary classes. And their culinary classes are housed right across our street. It's actually with Memorial's Wellness Center. There's a fabulous chef, her name's Nicole, that works with her too. So we, focused on the family medicine program because of the diabetes education program and submitted the application. And then IPHI came back and said, wait, we want you to include someone from Jackson County. Well, that's where our Carbondale clinic is housed. So I got in touch with Leanne, the administrator there, and then OJ, who's the CHW, and we hashed out the details and resubmitted the application. And then we had to find out, well, who are we going to get to provide this produce? And that's where the Farms of Illinois comes in. Next slide. So this is a picture of the initial food that was provided. This was back in the summer in August. You can see the peaches and tomatoes wouldn't be happening right now, but just what the Farms of Illinois is and what they offered. The Farms of Illinois stands for Farmers Alliance for Regional Marketing and Sales. It's a CSA, or Community Supported Agriculture, led by their Serena Basham and Clint Bland. And so their office is in Jacksonville, Illinois. They said there's about 18 farmers in the area that they collaborate to provide the produce and other things. They do a lot of wholesale as well as direct-to-consumer delivery. Next slide. So making those connections, Erin, the CHW director, pulled a list from our electronic health records report and found out that given that criteria, diabetes and Medicaid and food insecurity, we had a list of 157 patients that should be our first priority. But that's just the ones that have food insecurity as an ICD-10 code in our system, right? But if you take out that, there was close to 1,000 patients. So we were okay with just focusing on the 157, at least first off. But with that, our CHW team made the calls to offer this to our patients. What surprised me the most was that people declined or didn't even return a call. And I never thought people would decline fresh local produce. But anyways, they did. So then as time progressed, the dietitians here, as well as the CHW team, we identified patients who qualified for this program that might not have that ICD-10 code listed in our TouchWorks, but still qualified. And so we would, just in our day-to-day work, we would identify these individuals. And we made an Excel sheet in Dropbox, track their names, the calls, responses, and just a couple of the benefits that we've come across that you wouldn't necessarily think of was our CHW team expressed that some additional relationships have been built just beyond food insecurity and diabetes, that they've had more opportunities to interact with those with SDOH and also just open the door for conversations that might not otherwise have occurred. And my coworker Katie and I kind of had the same same reaction, that there's a deeper involvement for our patients that maybe we hadn't approached for diabetes education before, or just having that opportunity to have the produce, have the classes, and so, and the fresh produce too. So it's just opening the door, better discussions and care. So we did see an uptick, especially in our diabetes classes in the fall, and had some very engaged participants in the culinary classes. They wanted to come back and again and again. So I have classes scheduled for February, which are in pretty good shape too, I will say. In November, that's when I decided to purchase those, what I'm calling the kitchen necessities, cutting boards, measuring cups, measuring spoons, food scales, thermometers, can openers, and then the divided plates, the plate style method.
It never rang, and then all of a sudden you called me back.
Could you please mute? Thank you. And then also elastic bands for strength training. And if you're wondering, I purchased those through Walmart, just because that's what happened to be one of the better places for us. So the culinary medicine classes were led by Dr. Satovia and then Chef Nicole, and they used the produce available from the farms of Illinois as part of their meal prep. Next slide. I love to tell about our diabetes conversation map classes. I wish I could say these were well attended and so greatly used, but people they're underutilized, and it's kind of sad. We offer classes on a monthly basis. My coworker Katie does hers on Tuesday mornings, and then I do mine on Thursday afternoons, and we rotate months. So it's a 4-week series of classes. They're extremely beneficial for our patients to help with their overall diabetes management, and they're conversation classes. So it's not me lecturing or using a PowerPoint. It's just a conversation. And if you go to the next slide, you can see a picture of Anne and then the conversation map. This was taken a while ago when we all had to wear masks. But anyways, that map behind her is the 3rd week of the session that is monitoring your blood sugar, and it has the goal is for a steady flight. So I love that concept of the hot air balloons, and you never want to get too high or too low as far as blood sugar goes. And so this is, like I said, week 3. Week 1 then is the getting started, the myths and facts about diabetes, what the liver does, what the pancreas does, what's a carbohydrate, a protein, and a fat. So just kind of the basics and getting a definition. And then the meal planning is the 2nd week. The 3rd week is the monitoring and the ups and downs of blood sugar. And then the 4th week is continuing your journey, which also talks about the potential complications of poorly controlled diabetes. So this is what we've been using since we started our diabetes education here in 2016. And there's a leader's guide, and there's prompts that go along with it. And we keep flyers available for in our clinic and the main reception areas. So it all comes together, and it's a great offering for our patients, and we don't charge either. And so it makes a lot of sense. So moving on, our current situation then is currently we're ordering usually 5 boxes of produce each week. And in the last couple of weeks, they've had things like a butternut squash, carrots, microgreens, onions, sweet peppers, potatoes, cabbage, and spinach. And then they recently started with Cahokia rice. And so this is a specialty rice that's actually grown in Southern Illinois. And it's been grown to have a lower glycemic index, so a little bit more protein, a little bit less starch. And so they've connected with this group as well, and have been providing I think it's a 5-pound rice bag. And so each time that we have these produce boxes offered, Chef Nicole and I put together recipes to go along with the produce in the box. And then I also printed out a short article on microgreens a couple of weeks ago when that was included, because that's just not something we're all that familiar with, but it was fun to kind of do some research and put things together for that. We also have our diabetes classes. They're ongoing and will be. And then the culinary classes are scheduled to be offered again in March, maybe when it warms up, hopefully. So what's going on in Carbondale? Unfortunately, we've kind of not as much progress. I've met with the administrator several times and then connected with their CHW lead. His name's OJ. But remember, they're a smaller clinic, less staff, and they don't have dietitians on staff. So they said that their referrals for diabetes education is sent to the local hospital outpatient educators. We've tried to offer virtual classes for diabetes, but can't get leadership to agree to that, even though we have the MAP classes on PowerPoint and can easily transfer that over to Zoom or WebEx. We are trying to or planning to record the culinary classes. That didn't happen when they offered them in September and October, but it's still a discussion point. And now, unfortunately, OJ is on medical leave, so that still haven't moved forward too much on that, but no worries, we're still working on it. There is some good, and the next slide has on that of what's going on in Jackson County. One of the cool things was that we used the waiver money to purchase a cooler or refrigerator, whatever you want to call it, for Carbondale to store their produce. And OJ said that the first day that was delivered, it was put to use, not necessarily for our produce, but for some needs that they had. And so that was a really big win right there. Made me feel good about the work that is involved in this. And then I'm also having conversations with an organization called Top Box Foods, and they're out of the Chicago area, but they're trying to expand across the state for produce delivery. Nothing's materialized yet, but I'm actually having a meeting with him tomorrow at 11, so we can get going on that. He said he had some good ideas to share. Just seems like they've been really busy and hard to find the time to connect. So some plans for the next 5 months. Next slide, please. That I do want to dedicate some more time and attention to Carbondale. That's my priority, but continuing what we have in place in Springfield, I think it's moving forward and we're doing okay here and reaching a nice amount of individuals. I do want to secure produce for Carbondale specifically, and also in case something comes up with the Farms of Illinois to be limited, that there would be some other opportunities too. I'm planning to push for more virtual diabetes and those culinary class offerings, and also share those stored kitchen goodies that I currently have on hand. They don't do anybody any good in my drawer in the back in my cabinet. Next slide. So that wraps it up. Thank you for the opportunity for this. Thank you to IPHI for this opportunity, and to you for your time and attention. And I'd welcome any comments or questions or discussion.
Hi, Gayle. Rick Crumpet, Near North Health in Chicago, also an FQHC. And we're interested in getting a similar program off the ground and potentially also applying the 1115 waiver to be able to fund it. In terms of recruitment, I know that you talked about that pool of 1,000 possible candidates, and then the smaller list that also screened for food insecurity. That was the 100 and something. Forgive me, I'm forgetting the exact number.
Yeah.
How did recruitment efforts go? What did you find that was successful, and what did you find that didn't work? Because for pretty much any culinary classes, we're always shocked when people don't want to take us up on it, but I guess I can't be scratching my head with the weather the way it is right now. Like, people don't want to make an extra trip to come out when it's this cold, but just generally we have a challenge with people if they don't already have an appointment scheduled to make a separate trip to one of our clinics to be able to get nutrition or diabetes education.
Right. So we initially, our CHW team did the initial calls and reached out to the patients, and they tried a couple of times, and like, certainly some people just said, we're not interested in it, but other people really jumped on the chance. So it's just a matter of continuing to push it and continuing to be positive about it. I think it also depends on kind of the script that was used for that individual making those calls too, that it then might have made a difference.
Were you offering any incentives for people? Are you saying, like, if you show up, you can get leave with your produce box or leave with this culinary kit or whatever?
Right. The second time we offered the culinary classes, we did offer an extra bag of produce. Like, they'd already been given another bag or offered that first, and then another bag if they came to the classes. And I'm going to do that with my diabetes classes in February and offer anybody that comes to all 4 of those sessions. Because there's a nice incentive to even have that open the door for the conversation, and then also to actually show up. So those are part of but I don't have any good advice on how to connect or how to get somebody in the door. One of the things we have talked about doing is using some of the funding for bus tokens as
Gotcha.
well.
Okay.
That's just
Thank
something
you.
our clinic offers too. Yeah.
Hi, Gayle. Thanks for the presentation. It was really interesting to see kind of the model of how you carried out this program. I guess I'm just curious when you mentioned that the Carbondale location is struggling to offer the same types of classes and the lack of dietitians on staff there. Have you partnered with the extension at all? So I feel like there's a really good opportunity there to use some of
Okay,
extension's
I will make note of that.
resources. Yeah, I'll send you a follow-up email as well,
Okay.
but I think that's something that a gap that we could definitely help fill.
Awesome, yeah. Thank you. You're Caitlin. Okay,
Yeah, I'll send you an email this afternoon.
thank you. Anyone else?
All right. Well, I guess if anyone thinks of anything, please feel free to drop it in the chat.
Yeah.
Thank you so much, Gail, for your presentation. Really appreciate it. I'm
My
going to
pleasure.
stop the recording now.